About 250,000 people in the Charlotte area are Medicare patients, and a new system significantly limits what providers many of them can use for certain services. Members of Congress and some patients are already raising red flags about this. Eyewitness News reporter Lindsay Sheldon went looking for answers.
This is the machine Marilyn Graham uses to breathe at night. It helps with her sleep apnea.
There are times when I gasp for air and times when it seems that I'm not breathing at all.
3 weeks ago, she accidentally tore this mask. She called her provider for a new one and learned the business couldn't help her anymore because it didn't win a bid. As of January 1st, Medicare patients have to use companies that won bids in Charlotte's competitive bidding system. If they don't, Medicare won't pay for their services.
You have no control over who you go to.
Providers competed in 9 categories, like wheelchairs and equipment like Graham's machine. Companies with the lowest bids won the right to keep providing equipment and services to Medicare patients. Medicare officials say it will reduce costs and fraud.
Over the next 10 years, when the program is fully phased in, both taxpayers and beneficiaries will save $28 billion.
If a company didn't win certain bids, its patients now have to go elsewhere.
We can't sell Medicare walkers anymore.
Bill Griffin of Griffin Home Healthcare laid off 8 employees after winning only 1 bid for oxygen equipment. He spent nearly 30 years in Charlotte providing walkers, hospital beds, and feeding equipment, but said he couldn't bid low enough to win in any of those categories.
I think there are a world of companies that will go out of business.
We went through the list of more than 200 bid contracts and found that more than half of the contracts were awarded to providers outside the Charlotte market. Some are in California and Illinois, but providing services and equipment to people in Charlotte.
But we're trying to balance competing tensions about working with those suppliers that know a market, but also those suppliers that want to come into a market to create the most competitive bid.
As for Graham, she spent days calling approved providers. It took more than a week to get her new mask. Now she's worried about other Medicare patients who may not know about the changes.
I mean, there's no way that they're going to know until they actually have a need.
Lindsay Sheldon, Channel 9 Eyewitness News.